Time now for Morning Rounds, our look at the medical news of the week. For the millions of Americans suffering from dementia, unpaid caregivers, such as family and friends, often produce invaluable assistance.
A poll out this week from the University of Michigan asked these caregivers about their personal experiences. 148 individuals took part in the survey. All of them were between the ages of 50 and 80. 62% were women, and nearly half had another job in addition to caregiving. Here to break down the findings and more is CBS News contributor Dr. Tara Narula. Great to see you, Doc.
Great to see you.
So this is kind of an unusual study. You don't see a lot of studies about caregivers. What did they find?
We don't see a lot of research about it. We don't talk about it enough. But this is really a group of unsung heroes. They don't get paid. They don't get a day off. They don't get recognized. And in many times, they're caring for people who don't recognize them. In this survey, 60% of the time it was for a parent. 19% of the time it was for a spouse. We're not talking about weeks or days. This was, for the most part, years of caregiving. 40% of the time for 9 hours or more a day, essentially equivalent to full-time employment. So what was interesting was that while 78% said that it was stressful, 85% did in fact find it rewarding. And 91% said it gave them perspective, meaning it gave them time to think about how would they want to have their caregiving needs met when they became older.
So what are some of the challenges these caregivers face, according to the poll?
They're big challenges. As you mentioned, this is a group that's essentially over 50. Many have their own kids. Many are working. 14% said that they did not feel they had the physical and mental health capable of taking, or the abilities to take care of someone else. 60% essentially said that it took away from their abilities to deal with their own daily responsibilities, to go to the doctor, to have time with family and friends. So lots of challenges for this group.
So how do we help caregivers?
Well, we need to provide them access to resources and really look at this as a team effort. So we need to do a better job at promoting social service agencies, classes, family therapy, essentially anything that can help support them. Healthcare providers need to play a big role too in screening and asking about caregiving responsibilities, and family and friends really need to pitch in. You know, I recently had a patient in my office for cardiac complaints, and when I started talking to her, she broke down in tears and told me she essentially had started getting all of these issues a couple of years ago when she gave up her life, moved home from Europe, and had to care for her father. And we spent the rest of the visit really talking about how to get her in to see a therapist.
So recognition and acknowledgement that these people, that these folks exist, and they are dealing with a lot of duress in their caregiving. It seems like the first step. Okay, our next topic, the beating of our hearts. A recent study in the journal Circulation looked at one of the most common types of irregular heartbeat, atrial fibrillation.
Researchers examined more than 79,000 patient records from 4 studies out of Europe. None of the patients had been diagnosed with the condition at the start. They had a median age of 49 and were followed for an average of about 12 years. Tara, you're our resident cardiologist. What exactly is atrial fibrillation?
So this is the most common arrhythmia. Essentially, the upper chambers of the heart are supposed to beat synchronously, to beat and pump the blood down to the lower chambers. In AFib, essentially what happens is those upper chambers beat irregularly. They quiver. So there's not efficient movement of blood down to those lower chambers, which means it can stagnate in the upper chambers, form clots, and those clots can go to the brain. This is why it is puts people at increased risk of stroke, essentially 4 to 5 times increased risk. There are things that are associated that can increase the risk of developing AFib, for instance, aging, hypertensive heart disease, or if you've had a history of heart attack, heart failure, valvular heart disease, obesity, alcohol, medications, thyroid problems. So lots of things that can predispose. Some people can be symptomatic. They can feel palpitation, shortness of breath, chest pain. Other people can have no symptoms. And it can be something where it comes and goes, or something that's chronic.
And what did the study find, and what were the major findings?
Well, the major issue is that the lifetime prevalence is really profound. It's, essentially in this study, about 24% developed AFib by the age of 90. The incidence increases for men by the time they're 50 and older. For women, it's a decade later, 60 and older, the incidence starts to go up. It increases mortality to a great degree, so a 3.5 times increased mortality in this study. And one of the biggest things that put people at increased risk was increased BMI, or body mass index, so being overweight or obese. The nice thing about knowing that is that it is something that's modifiable, so people can work on getting healthy, eating a healthy diet, losing weight, and exercising.
Okay.
Finally, there is no crystal ball in medicine, but using technology might help predict which strains of the flu will threaten us. A new study in the journal Science Translational Medicine showcases a proposed flu forecasting model that incorporates ongoing evolutionary changes in the virus. Using past data, The model was able to predict outbreak levels of a certain strain of the flu accurately from 2002 to 2016. The hope is this type of model will help flu-fighting strategies worldwide in the future.
Yeah, really important, because usually we just look at how fast the virus is traveling, and we can't really assess that until the season starts. But with this, you're looking at how it's mutating and changing, and that will give you an earlier sense, the ability to forecast a little bit earlier.
It is very heartening to know that the tech has helped in recent years in terms of targeting the right strain.
That's right.
All right.
Get your flu vaccine.
So, yeah, everybody get their flu. I actually got mine already.
Okay, good.
Dr. Narula, great to see you.